Nelson is supposed to be joining video conference. Cavell, absent with notice. And Gingell is absent with notice. Kuhn,
Here.
Lubes.
Present.
We have a quorum.
Thank you. Please join me by standing to recite the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The first item is approval of the minutes dated November 2nd, 2021. I have a motion by Commissioner McGilvery, support from Commissioner Hoffman. All in favor say aye.
Aye.
Opposed? The minutes are approved. Next item is approving the agenda. I would like to make one change on the agenda to move item T, a resolution, to item G. And that would group all the items with our Sheriff's Department together. Would anybody like to support from Commissioner Powell? All in favor say aye.
Aye.
Opposed? That motion is carried. Our next item is public comment. Is there anyone from the public wishing to speak to items on the agenda?
Yes.
So if so, please come to the end of the table and state your name and city.
Good morning, Commissioners. My name's Catherine Kennedy. I'm from Lake Orion. And I'm pleased to see that we actually have an amendment that actually increases the money for our sheriff department. We really need to make sure we support our sheriffs and do not follow the failed policies that so many have done throughout the country. And I really think we need to reverse the corrections interlocal agreements that do bail reform and drastic things that make us less secure as citizens. I am still very concerned about the airport lease with Customs and Border Patrol and the fact that our government is not vetting the people that are letting into our country. And in fact, the cartels are strengthened by the actions of our own government. It's shameful. It's scary. I've actually been in a socialist country to understand how risky it is. And so many of the people that seem to think that socialism is something positive for our country, I would tell you they've never seen it. They have no idea what they're saying. There's nothing positive about that system. The people that are immigrating to our country come here because of freedom. And this is what is at risk right now for every one of our citizens, is the right to have our own everything, right to the free choice. This is what's really being challenged in our society. The media is lying so often that it's shameful. And it's very important that we read the documents, not listen to the narratives that are being presented, because so many of the narratives being presented are completely false. And I would tell you that's the reason you people probably wonder, why does this lady keep coming? The reason I'm coming because my grandchildren will have to pay the price of the failed and erroneous actions that are being taken in this society right now if we, the people, do not clearly stand up and say, no, the silent majority needs to no longer be silent and say, no, we want to remain a republic. We want to maintain our democracy. We are not okay with a socialist takeover of our government, which is what history will frame this moment in time. So we need to really be mindful and not have our entire integrity of our society crumbled. The lawlessness is shameful. It will never result in anything positive. And I'm very concerned. I'm very glad at least to see that there's some positive change for the sheriff's budget, because they are so critical to all of us citizens having safe environment to live in. And safety should never be partisan. Safety should never have anything to do with the Democrat or Republican. And it's so offensive to me that so many things are being deliberately done to create division in our country that are based on Marxist ideology, whether people realize it or not. I know they're trying to get rid of history so don't realize it, but these are actually what the Nazis developed against the Jews back in the 40s. So it's really important we have accurate history and a study of our Constitution so people realize they already have the rights they are arguing to get. It's just the government people that want more money from us. It's got nothing to do with anything humanitarian. Thank you very much.
Thank you. Anyone else for public comment for items on the agenda? This portion of public comment is closed. Oh, I'm sorry, I didn't see you stand up.
I was slow, I'm sorry about that. Ms. Loops. Okay, my name's Heather Smiley, I'm from Lake Orion. I guess, a lot of I'm so happy that the State Department of Police get their funding, that's lovely. My one thing, because I don't have much information on what the meeting's about today, it looks like the chairman of the Board of Commissioners is authorized to execute the grant award and to approve any grant extensions or changes within 15% of the original award, which are consent with the original agreement as approved, per your words on your agenda. I don't understand how that doesn't come to a vote when it has to do with money. I can understand, like, if it's 15% less, but 15% more on $2 million or whatever is still a big chunk of change. So I think that that's a little bit too much power without some kind of board or negotiation to make sure that one person is not allocating our funds as they wish. Again, it is taxpayers' money that is being used for all these, so I think the voice of the taxpayer should be heard and understood, and bipartisan is really just needed for everything. So, supporting our schools, supporting our veterans, supporting our health. And I do notice that a lot of this money is in regards to health and public safety. I see they've got vaccine little hot spots popping up in middle schools, and I think that's inappropriate that they're giving shots to our children without parents' consent. I also feel that it's inappropriate that we are allocating money for the airport, which is going to be leased for the federal. We got 112 Pike Street, which is shady and all goes as far as who owns it, why we're paying $12,000 a month to Joe's Automotive in Pontiac, and why it is deeded to Salvation Army. I feel hand in hand with the information, I think it's on tomorrow, with the Lake Orion, the Eamon Center. I really feel that Oakland County is making a pathway for illegals to come into our community, that the funding that they have for a lot of these welfare kind of programs for the community does not include specifically citizens. It is residents, which can be anyone from anywhere. And the vetting that is being done is pretty bad, considering the American people are being put through the ringer. I am on the verge of losing my job, yet I come here today not getting paid because of something that is important to me, because vaccination status. That's a personal choice. I'm for people who get vaccinated and wear masks. It's a personal choice, But I think that forcing people and citizens is pretty much against and a violation of our Constitution, both Michigan as well as federal. So I just hope that you guys can kind of think clearly and think about the actual citizens that you are helping. I know a lot of good is done here. I do. I appreciate your time. I appreciate all the work that you guys do. I know it's not easy to do what you do, to mitigate between one person's ideas and another person's ideas and kind of meet slowly in the middle. I got kids. I know it can be, they're big now, but it can be difficult to take everyone's ideology and make a bill that is beneficial or a resolution that's beneficial for everyone. But we are patient. We will allow you to take your time to make sure that all voices are being considered in the matter, and I just appreciate you guys and what you do. Thank you.
Thank you.
My name is Sandra Carlan from Novi, and my comment is in relation to number 9, section N, the Emerging Threats Local Health Department Agreement. I have no idea what's in that. I'm hoping that person will be speaking to that today so I can learn more about it. But I feel that a very serious emerging threat right now is that people who are already have natural immunity to COVID are being fired from their jobs. Their natural immunity is being discounted, even though studies and people who are experts in that field, like Dr. Peter McCullough, people have come out and said that it's much more safe for a person who has already had COVID to be in a group where there is COVID being shed or viral loads. And so I want to suggest to this board that it would be very helpful that every single shot that is administered has to be preceded by a test for natural immunity. I think it's ridiculous that they are vaccinating people. I know someone who works in first responders, and they had chicken pox when they were 4 years old. They're 31 now. And guess what? They did a titer, and they did not vaccinate them for the chicken pox because they were already immune to it. We are rolling out a program at disgusting warp speed in our community. It's not just the country, it's not just the whole world, but if you've been watching at all what's going on in other countries, people are having adverse events much more if they get vaccinated following the natural immunity that they've already had the disease, plus it's ruining their natural immunity. And this is a fact. This is a absolute. They want to follow the science. Why don't you follow the science to find out who's already had COVID? Now they're coming out with this Omicron, and they're going to get everybody freaked out like, oh, anybody who was hesitant, you better get it now because this one's coming from South Africa, which is really interesting because when it came from China, to call it the China virus was like unacceptable. But this one's coming from Africa. The African Americans are being labeled as the source of this is Africa. That's really racist if the other is racist by calling the China virus China. So let's be consistent about our behavior, and let's look at, this board could pass and could be involved in getting a decision that anybody who's vaccinated in Oakland County, vaccinated with quotes, needs to be tested for natural immunity, and the natural immunity is at least as good as the status from the shots.
Thank you. Anyone else for public comment? All right, this portion of the public comment is closed. We move on to communications. There are 3 items under communications. The first is the Oakland County Blueprint to End Homelessness. The second is the 2021 Empty the Shelter event, which is December 6th through the 12th at the animal shelter. And the third is the intake disposition report from October from the animal shelter. I have a motion by Commissioner McGilvery, support from Commissioner Powell. Any comments or questions? All in favor? Oh, here, we're prompting the vote. Commissioner Powell, are you able to access Civic Clerk? So Commissioner Powell will have to do a voice vote.
Powell?
Yes. Oh, and Commissioner Nelson has joined us remotely.
Yes. Commissioner, Chairwoman Loops, I am attending virtually due to medical.
Thank you.
I just wanted that to be known. Thank you. And I'm residing in Waterford.
Thank you. Are you able to vote, Commissioner Nelson?
So I went through the same process as I did. I followed the link that Mike Keys had provided. It did show that I entered the public health and safety meeting,
Okay.
but I did not get a prompt box to
Okay.
vote.
Could you do voice vote, please?
Yes. Yes.
We have 6 yeas, 0 nays.
All right, motion carries. Thank you. We move to our regular agenda. First item is the appropriation and authorization of American Rescue Plan Act, Oakland Together School Mental Health and Wellbeing Grant Funds for the Community in Schools Initiative. And who would like to make a motion by Commissioner Powell, support from Commissioner Hoffman? And we have one of our directors, Mr. Hobbs, here to speak to this. Welcome.
Hey, good morning, Chairwoman. Good morning, committee. We bring forth our second initiative. As you remember, we set aside $2 million to support schools around mental health, wraparound services. Our first one, we really appreciate your support for that one, was for the youth assistance of $50,000. This one we bring to you today. We're really excited to bring this initiative to you today. I have Mallory here from Communities and Schools, and I also have Alice, who's been really working with the administration. We're working with Mallory from the executive's office to bring this forth. And so this one is for $500,000. I think the beauty about this one is that we were able to leverage our dollars to secure additional dollars from the Balmer Group, which is a foundation that's been operated here locally, supporting schools and initiatives like this. So leveraging an additional $500,000, and I think you'll also hear later in the conversation that schools are also going to bring $1. So for every dollar we bring, for every dollar Balmer brings, the school brings. So we were able to take, $1 the school would naturally have and turn it into $3. So I'm excited to bring this forth. I'll turn it over to Alice to kind of introduce Mallory and kind of give a description about how things are going to work.
Thank you, Rudy. So we are very excited because this is a leveraged opportunity and an opportunity for us to partner with the schools. Two things that we think are important to developing these kinds of programs. And we are particularly appreciative of the fact that we are able to implement an evidence-based program so that we go with confidence that this will do what we intend for it to do. And I'm going to let Mallory, who is the Executive Director of Communities and Schools in Michigan, address exactly how this is going to happen.
Hi, everyone. Thanks for having me. I'm Mallory DePreckle. As Alice and Rudy both said, I'm the Executive Director of Communities and Schools of Michigan. And through this partnership with both Oakland County and Balmer Group, we are going to be able to leverage funding to provide wraparound supports, otherwise known as integrated student supports, in 6 districts across the county. This is unprecedented for us. This is a great example of what happens when a county and a private foundation and districts come together to provide this support. Communities and Schools, like Alice mentioned, is in an evidence-based model. We follow a model again that supports students at all levels of their learning. So I always like to say we let teachers teach and we do everything else. So everything from basic needs to case management to social emotional learning to mental health, all of that goes through our site coordinators. We provide one full-time site coordinator in each school that we are in, and hope to expand this work throughout Oakland County. We are currently in 8 other counties across Michigan, and hope to expand the work in Oakland County as well.
Thank you. Commissioner Hoffman?
I have one question. Thank you guys very much. What are participation fees paid by school districts in the amount of $22,500? What is that?
So the fee is, so every school district has to have some sort of buy-in to partner with communities and schools. That's for obvious reasons. Principal support, district support is all imperative to our success in the building. That number could be up to $75,000 if we had no outside support from private funders or city folks like you guys. So that's that 2-to-1 ratio that Rudy was just talking about, where Balmer's going to pay $1, Oakland County pays $1, and then for those $2, the school only has to pay $1, basically. So it's the final third of that total $75,000.
Okay, thank you very much.
It's a
Commissioner
little less
Powell?
than 75, as I just did the math in my head.
I don't know if this was already been granted or you already know the districts. I probably missed that statement, but I want to know which districts was chosen to be a part of this, if it's been chosen, or even if it's a potential of what district you all are looking at to partner. I would like to know that. And then I also wanted to know what other counties are you all currently in?
So the county's question I can answer first, because I just did this list. We're in Wayne, Macomb, Washtenaw, Berrien, Ingham, Eaton, Genesee. I think that's, what is that? That's 7. I know I'm missing one more off the top of my head.
Calhoun, maybe?
Thank you. So those 8. And then the districts that were chosen were suggested by both Balmer and Rudy, and they are based on free and reduced lunch numbers. So, and Alice, I'm going to forget them as well, but Hazel Park, Oak Park, Southfield, Pontiac, and what's the 5th one?
Ferndale,
Ferndale,
Madison.
and Madison. So 6.
Okay, Hazel Park, Southfield, Ferndale, Madison Heights, Pontiac, and what was the other one? Oak Park?
Park.
Oak Park.
And just to be clear, we looked at the free and reduced lunch numbers for each district. If we ranked them from highest to lowest, Southfield would actually be number 8. So Southfield actually made the list because the superintendent there has already committed to the community schools model in Southfield. So so they're a little bit out of order, but just to be, to be transparent on how the list got generated.
Okay, thank you.
Thank you. So what are the wraparound services? What does that look like?
So a wraparound support could be anything from a toothbrush to a kid, right, who needs, who doesn't have the toothbrush at home, to providing tutoring, to providing college and career support, taking them on field trips when we're allowed to do that again. We connect them to mental health support that they need. We connect them to any sort of outside after school activities they may be interested in. It's anything that's not teacher-led, basically, a support for a student that's not in the classroom necessarily, but may help them succeed in the classroom.
Thank you. Commissioner McGilvery?
Thank you, Madam Chair. Just a question. This is based on lunch programs at the schools, as you mentioned. I'm curious why you think that it's just going to, mental problems are just going to affect the people who get a free lunch.
Oh, we wish that were true. The reason that we looked at that was we were trying to figure out where were the most vulnerable students, and and obviously are open to other decision rules if there are other ones that make more sense as we hope to grow the program. But that was sort of our proxy for knowing where the most vulnerable children might be.
Thank you.
And I would just add to that question is that, I think this particular initiative is really focused on providing, wraparound services, where mental health is maybe just a small portion. They're not necessarily providing mental health services. Like she said, it can run the gamut from giving a toothbrush to setting up a field trip, right? So this is kind of where we thought that a initiative like this will have the greatest impact in schools where we think there's the most need for their services.
Commissioner Powell, Commissioner Nelson.
Thank you, Madam Chair. I just want to get some clarification. I know in a previous conversation in regards to this program, Waterford was mentioned, and I didn't hear Waterford be mentioned today. So can I get some clarification on whether or not Waterford is a part of this program? Thank you.
Waterford is not currently on this list. And I don't know a conversation, so that's why I'm hesitating.
The conversation we just had here a couple days ago on Tuesday.
Yeah, I think we were confirming those, and if water was mentioned, I think that, in our mind, this is going to expand beyond these 6 schools. These schools have, actually shared, interest up front. So I do, as we continue to move down that list, which I think will be fairly soon, I would think that Mallory will probably get to work on this, probably sometime tomorrow, and really be reaching out to superintendents to figure out, gauging their interest, based on the free and reduced lunch. So I think that there's conversations with that.
Commissioner Nelson, I think I understand where I might have misled you in the earlier conversation. The list that I gave you was the list of school districts in order, and I see that Waterford is like 7th on the list. So I don't know if I apologize if I misspoke, but they are sort of like next in line, if you will. And I think that, part of what we're going to be doing here is going through the list to make sure that the districts who are invited choose to participate. So if one of the ones that we've listed doesn't participate, we will go down to the next, the next district in line. Is that your understanding?
Thank you, Alice. I appreciate that. Thank you.
Yeah, I apologize for that.
Commissioner Powell?
So I was reviewing this org chart, and I wanted to make sure we're offering these wraparound services. And can you, again, explain to me what positions will probably be more indirectly or readily at the schools, more in contact with them? What positions would that be?
Yeah, so the organizational chart that you guys are seeing was a proposed plan. Like I said, we're currently in 60-ish schools statewide. This would add another 12 to it. So the definite positions that this would cover are the student support coordinator in every school. So that would be a full-time position in every building, plus a program director to oversee those supports. And then the other portion of this is capacity building on our end.
Or maybe not.
There is a portion of it that has to cover the administrative.
So when you say capacity building, is that where you would kind of lean on the internal staff from the school to assist moving forward with these 2 people just overseeing it, or you kind of run everything on your own?
We are a separate 501c3. This is our organization. So
Okay, got it.
Through me. It does
Okay, yeah.
not go- it all-
Okay, I was just trying to understand structure, that's all. So I kind of
Yes,
know
no, we are
what,
separate.
dependent resources that the schools can kind of depend on. Because again, y'all going into districts who have their challenges already. And I know, especially with my Pontiac schools, I represent Pontiac, just to let you all know. I know they will need like that standalone support where it really kind of carries itself, not rely on what's in the district already. So I just wanted to make sure it was a standalone type thing. Thank you.
Yes, in Pontiac.
Mallard, could you speak to your experience in Pontiac already, so the commissioner?
Yes, definitely. So we're actually already in the high school and the middle school in Pontiac.
Yep, you don't even gotta say no more. Thank you so much. That's all I need to know. Thank you. So I know exactly, you know exactly what I'm talking about. Okay. Thank you. You ain't gotta go into detail. Thank you.
Perfect.
I already know.
Commissioner Kuhn?
I think the questions have been answered. Thank you, Madam
Thank you.
Chair.
Commissioner McGilvery?
I just want to state that I'm not real sure about this, only because of the way it's based on free lunch program. We have people in other districts, Berkeley, Madison Heights, Bingham Farms, that some of those children are having mental problems due to the pandemic, and yet they're not getting addressed. So I have a real concern as to how we pick and choose what school districts are getting it.
And Commissioner, I think that's a very valid concern. As I mentioned at the very beginning, this is the second initiative that we has brought before this committee for approval. You remember the first one being the 50,000. Now we're doing the 500,000, and we have a leverage opportunity here with a foundation. I think the third one that we're really trying to work out the details of, which I was hoping to bring today, I just haven't had it, I haven't had it fully vetted yet to really kind of bring it to you guys. But I do think that, with that particular initiative, you'll see that be more of a countywide, kind of from a countywide perspective. And I think you also have to understand that, while it's not necessarily school-based, Alice brought forth a $10 million grant that we worked through United Way. So there's multiple initiatives that are, that we're implementing that will touch, folks all over the county. I think that as we look at this one, we do think that, providing some of those wraparound services are really, really important. And while we've spent, probably somewhere in the neighborhood of about just over $10 million, well, I should say $8 million, strictly towards mental health, I think you're going to see another proposal that's going to come and add to that, mental health push. Mental health that push is not lost on the administration at all. I think that we wanted to use our Q dollars to support schools and mental health activities here in the county. So that's not lost on us.
Yeah, and Rudy, if I may just add, I think that to get hung up on when I said the mental health portion, I think my point is that if a child needs to find those mental health supports, we will get them, but that's not all we do, right? So I think that there's a bigger piece to this. I'm just thinking the past week we gave away 650 turkeys to families that needed it, right? So it's this whole gamut of things that we recognize all students do need. But just based on need and realities of a nonprofit, right? There has to be some rules we have to follow or a plan we have to follow, or else we would be in every school everywhere. I would love that, but it's just not realistic right now given the money and the capacity of it.
Thank you. Commissioner Hoffman?
Thank you. I think Commissioner McGilvery's concerns are well-founded. If we're spending this money in schools, and I know the schools have to participate, but it should be for any child who needs it. And I think the only rule should be is those who need it get it, and it should not be based on if you get a free lunch. And you suggest there's other programs for those other kids who don't get the free lunch, but we're already in the schools. I mean, what's the other program that for the people who don't get free lunches? I mean, the biggest concern is that the kids get the help they need. So what's that other program you talk about where you don't have to be getting a free lunch?
Yeah, I think that we're getting to the point where we can bring that before the committee. And I'm hoping to have that kind of nailed down so that when your January committee meeting hits, we're able to do it then. But I will say, look, there's, none of these initiatives are the, single silver bullet, right? So, I mean, there's going to be a number of initiatives that we, when I say we, the executive office, the board of commissioners in partnership, that will implement, throughout the county. And, as we talk about, equity here, at the county, equity means you're, meeting people where they're at and what they need. And so when you look, one of those indicators in terms of need is, free and reduced lunch. I mean, the state looks at it, the federal government recognizes it, the county recognizes it, as an indicator in terms of need. And so for a program like this one, an initiative like this one, I think that's a fair indicator to look at for the type of services that Mallory's nonprofit provides. I think that the other initiative that we will bring to you won't look at free and reduced lunch. I don't think that's the indicator that we want to, really base the program off of. So I think that when we bring that one to you, I will hope that you guys will see, our intention is to, serve every kid, particularly around mental health. This one is, really kind of providing the wraparound services. And again, none of these ideas were kind of, developed in a vacuum, right? We reached out to superintendents, we've had conversations, we've reached out to the Oakland ISD to really kind of vet these ideas, through the people who we want to serve and support. And so, these are all things that I think that if it was something that was a red flag for them, they would have, raised that flag and say, Rudy, I think you're going down the wrong path. But these were ideas that, they very much embraced.
And Rudy, if I could add to that, I do think that we do want to think about these proposals in terms of a suite of services. And so, the issue of mental health was clearly one of the first things that we looked at, because the American Pediatric Association says that we're in an emergency state in terms of our children's mental health. So that was why, we first came to you with the United Way competitive grant, where a lot of those programs do go across the county. And I just want to be clear too, that the decision rule was how do we start this kind of program? How do we start communities and schools? And we know we had experience in Pontiac, and we knew that we had limited funding. So the free and reduced lunch was a proxy for where the most vulnerable children. That doesn't mean that if you are a student in one of these school districts and you're not on free and reduced lunch, you will still be able to avail this program. It's sort of at a macro level that we're using the free and reduced lunch to say, we have a limited funds, where can we start?
Thank you. Any other questions? Commissioner Hoffman?
Thank you very much. I think your program is vital and needed, and I do thank you for that. But Mallory suggested that those that don't get a free lunch won't go without help. And my question was, tell me that program. If you don't get a free lunch, how do you get some mental health assistance?
And I think that what Rudy was saying was that there is another proposal that we're working on that will be countywide for all students who need to access mental health. And so it won't be this program.
Okay, back. Go ahead, sorry.
Sorry, to answer the question about when we're in a building, we have a caseload of students, but we also provide support to the whole school. So things from like a backpack giveaway that any child can access, things like school supplies in our office. We also do small group activities that any student can access. It's not just the highest need students. We do a lot of work with the highest needs. Those are our case managed students. But we also offer assemblies and career readiness programs and food distributions to the entire school. So in our numbers, we have a case management number and we have a whole school number that we do hit.
Okay, back to the original question. How do people who don't get a free lunch get mental health assistance? I'm not talking about career counseling or backpacks or whatever. What is in place now to help those kids who don't get a free lunch? And I know you're talking about a future proposal, but it was suggested by Mallory that they can reach out and get assistance. I'm just asking what program is in place now to give them that assistance.
Alice, you think you could talk a little bit about the $10 million in some of the programming that kind of came through there? I mean, there was a number of programs that came through that one.
Yeah, there were 42 programs that were funded throughout the county that addressed issues of mental health, mental and behavioral health. Just off the top of my head, I think that in the applications, about 60% of the programs address the needs of children directly. So, there are opportunities for children and their families to access mental health help through that $8.5 million that you approved in November. And those programs are starting to be implemented now.
I guess I still have the same concern as Commissioner McGilvery, is why do you have to say it's a free lunch? Why don't you say it's for every kid in school that participates who needs some mental health counseling or whatever?
Well, Commissioner, we don't say that. What we're telling you that because we were asked, how do you choose the schools? And so the decision rule for choosing the schools involved free and reduced lunch, because that helps us identify those districts that have the greatest percentage of, economically vulnerable children. So that if you go to Pontiac High School, no one says that we're in communities and schools is in this school because you guys are on free and reduced lunch. That's a macro decision that we make to try to figure out how to allocate resources. I mean, would we, ideally, if there was enough money, we would be in every district in Oakland County.
Commissioner Powell?
So it's kind of safe to say, because I know we going around and around. I do understand my commissioner's concern in regards to using the free and reduced numbers or data to determine the schools. But also, if we really want to just really keen in on this, these are the same schools that have the same issues, be it whatever the case may be, when it comes to the heavy need first. So again, even if you're looking at it from that perspective, and like they said, we just put out a grant, $8 million, that is kind of mirroring or going to kind of balance maybe what the schools are not offering, but at the same time, those are the same type of things that we're trying to move on to keep our eyes on the need moving forward. And I think that that's what they were saying, that too, we do have another phase of this to add schools on moving forward. But I just want to bring on to everybody's knowledge here, we all know that these cities that was mentioned are the schools in our county that has the issues already, even if you look at other umbrellas of what their challenges are. So, because we kind of keying in on the free and reduced, I get it, but y'all also know that these are the schools that had the same type of issues, anything else. So I am a support vote for this, of course, because my district always needs these type of resources. So I just encourage my commissioners to think of that right now, or we maybe put something in so we revisit, so they let us see the next phase list of schools to make sure you all are happy and okay that they're spreading the wealth a little bit more. But that's where I wanted to kind of leave that thought here with my commissioners. Thank you.
Thank you. I agree with Commissioner Powell. The wording might be better served for understanding as the average poverty level in each community and cite that and move from there. Commissioner McGilvery?
Thank you, Madam Chair. I just want to say that I will support this resolution because I think that there's kids that need the help. I guess all I would ask is that in the future, any programs, we don't just look at free lunch programs or the ones that can't afford it. I mean, there are homes in every city, every township, every village in this entire county that dad may have lost their job and they don't have the ability to do anything, no health insurance, and I don't think that we need to neglect those folks. That's what I'm concerned about. But I will support this resolution.
Thank you. Anyone else? Roll call, please.
Powell,
Yes.
Nelson,
Yes.
thank you. You have 5 yeas, 1 nay.
Motion carries. Thank you. Thank you for speaking to this. Nice meeting you, Mallory. All right, our next.
Thank you.
Thank you.
Thank you for having me.
Thank you. Our next few items are from the Sheriff's Department, the first being fiscal year 2022 Secondary Road Patrol and Traffic Accident Prevention Program. I have a motion by Commissioner McGilvery, support from Commissioner Hoffman. And Ms. Peer, thank you, welcome.
Here comes the undersheriff.
And Undersheriff.
So I can start out. This is our
Sure.
Annual Secondary Road Patrol grant award. We're very excited. Our original allocation was only $406,000, so we were going to have to make some position changes and actually delete a position. And at the 11th hour on Wednesday, we got our secondary allocation, and now the total funding is $967,000, and we're actually going to add 2 deputy positions. So so we are very excited about that. So
that'll take us to a total of 7 in the unit, a sergeant and 6 deputies, which is still a far cry from the 18 that were funded back in 1978 when it was originally funded, but it's not something. The sheriff, just so you know, personally met with the Senate Majority Leader, the Speaker of the House, the chairman of the appropriations committees and the governor's office, so we came to an agreement. MSA, Michigan Sheriff's Association, was very helpful too. This was a team effort by everybody to get the funding up. Now, it is for 1 year only. We still need to find a solution to the funding for this because it's all tied to traffic tickets. There's a $10 surcharge on civil infractions. And as you know, traffic tickets are down dramatically statewide because of COVID. And again, it's a 1 year fix. So hopefully in the next year, the legislature and the governor's office can come up with a permanent fix so we don't have to, at the last minute, do this stuff.
Thank you. Commissioner Hoffman?
I have a question. It said we're going to use some of this money to create 2 new Deputy 2 positions in the Patrol Service Division Traffic Unit. Where will those officers be used? Will they be contracted out?
Countywide. They go countywide. They service every community in the county.
Right, but will they be contracted to a community that contracts with the?
No, sir. This is paid for by the grant, and this
Okay.
is a benefit to every community in Oakland County. So
My
they'll
next-
go, if the chief from Birmingham calls, which he's done, hey, we have a problem down here, can you assist us? We've done that Cruising Woodward, issues like that on the side streets. We can't go on M's and I's. This is for secondary roads only, but we cover the roads like 11 mile, 12 mile, 14 mile, 15 mile, things like that.
Okay, second question is, weren't on our previous agenda before today, we had a bunch of contracts for local municipalities?
I believe those were removed from the agenda, and
Commissioner Hoffman, we were waiting on a review from our budget director, so they will come back to us. It might be that we have to have another public health and safety meeting before the end of December to review those final numbers, but there were 18 contracts on there. You are
Okay,
correct.
and that's not a problem, but I guess my question is, don't we do all that vetting and everything before it comes to the committee?
I'm not the budget person, but according to
know.
our budget people, they wanted to review the numbers again.
Oh, okay. Oh, they reviewed them once, they just want to do it again.
I don't know what discrepancy came up to
Oh, okay.
add
All
that.
right, thank you.
Okay, so we're back on the secondary road patrol and traffic accident prevention program. So the first motion was for the $400,000 amount with an amendment on here that adds the additional monies to it. So are we voting on the amendment?
As presented, that you got the changes here.
Yes.
This morning.
As
Yes.
amended.
Yeah, so we're voting on the amendment for the total amount with the 2 additional positions.
and again, we just got this last week. so that's
Perfect,
why.
life is good.
Wednesday night.
Wednesday night. the day
Before holiday.
Thanksgiving.
So,
Yep. Okay. Any other comments regarding this item? Roll call, please.
Howell,
Yes.
Nelson,
Yes.
you have 6 yeas, 0 nays.
Thank you, motion carries. All right, next
you.
item is the 2021 Law Enforcement Distribution Program. I have a motion from Commissioner Hoffman, support from Commissioner Powell.
This is our biannual grant from the state of Michigan, Michigan Commission on Law Enforcement Standards. Again, it's not a great amount. If you look, you have an attachment to this that shows what every department in the state of Michigan is getting. We get a fall distribution and a spring distribution. Our grand total's a little more than $75,000. I think there's a typo on there
Yeah,
also.
in the summary on the first page, I think it says $75,255.92, and it's actually $75,225.92 if you take the spring and the fall distributions. Just to clarify that it's
This is why we pay her to catch that.
$30.
It's good.
It wasn't her mistake. It was not her mistake, by the way. You know, Cunningham used to make all those mistakes.
Yeah, that's right.
So, but it's on the cover sheet if you're looking at the top.
Yeah.
The data behind it is correct, and the top
So,
sheet is.
anyway, it amounts to a grand total of $125 a year to train police officers that are licensed in the state of Michigan. It's a sad state of affairs. I mean, we're going to take what we get. You know, luckily, the county does supplement this for training for our corrections and road patrol deputies. But again, we need a permanent solution. This is not unique to Oakland County. Every police agency in Michigan is getting kind of, you know, the short end of the string here. And we're hopeful that the legislature can come up with a solution to, you know, properly. Everybody talks about, you know, improving policing. Well, the way you improve policing is by training. And if you only get $125 a year to improve it, it's not going very far.
Yep, I agree. Thank you. Any other comments? Roll call, please.
On item C, Powell,
Yes.
Nelson,
Yes.
we have 6 yeas, 0 nays.
All right, motion carries. Next item is fiscal year 2022 traffic safety enforcement. Who would like to make a motion? Motion by Commissioner Powell, support from Commissioner Hoffman.
This is a grant that allows deputies to go out on overtime and address specific areas for speeding, for seatbelt enforcement, and other and traffic fatalities. It comes from the federal government to the Michigan Office of Safety Planning, and then it is administered by the TIA. So we're looking for approval for this grant.
Thank you. Comments or questions? Roll call, please.
On item D, Powell,
Yes.
Nelson,
Yes.
Nothing's popped up.
Nothing
and
yet.
scrolling. There it goes. We have 6 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is an acceptance of a donation for 4 therapy canine dogs. Quite interesting. I love this item. All right, who wants to make a motion? Commissioner McGilvery, support from Commissioner Powell.
I'm going to turn it over to Gab, but if you haven't seen a couple of these dogs, you'll immediately fall in love with them. And we have worked out an agreement with both the deputies union and command officers union. We've got letters of understanding so that they're all put in place, and Gaia can tell you a little more about it.
Thank you.
Yeah, so this is a new program. If you recall, with our budget this year, we have a peer-to-peer support deputy, and then recruiting sergeant, and then we contracted a position with OCHN for crisis intervention. So this is a kind of an extension of that the sheriff had, and if anybody follows him on Facebook or the sheriff's office on Facebook, there's a lot of pictures of these dogs, and they're very popular. So the peer-to-peer deputy has one. We anticipate that the recruiting sergeant will have one. And I think there's a list in the resolution of all of the items, or all of the areas where we think that they're going to apply. I can tell you, just in our office, anytime any of them comes around, people are beaming. We're looking at different applications of maybe putting one in dispatch, because obviously that's a very high stress area, and or corrections. So it's a new program. Obviously they're donated, and then we're going to carry on the future costs. So today we're here asking for your acceptance of the donation.
Thank you. Commissioner McGilvery?
What's the name of the breed?
Cavalier
King Charles.
Charles Spaniels, yes, thank you.
I was going to say French food.
No. And I have to say, they're adorable, so anytime they walk through the office, we don't get to see them a lot, but just the reaction from the employees is 100% positive. I have not heard anything, but it's amazing how they can light up a room.
Excuse me. Thank you. Anything else? Roll call, please.
On item E, Powell,
Yes.
Nelson,
Yes.
you have 6 yeas, 0 nays.
Motion carries. Thank you. Our next item is for the fiscal year 2022-23 Cooperative Reimbursement Program. I have a motion by, who would like to make a motion? Commissioner McGilvery, support from Commissioner Hoffman. Thank you.
I think Suzanne Hollier, yep, there she is joining us. And
Thank you.
well, if it's okay with you, we'll have her speak to this.
Sure.
We have a great partnership with them. As you know, the enforcement unit are the deputies that go out and enforce this, and she can address this a little bit further.
Thank you. Welcome.
Thank you. Thank you for having me. This is a minor staffing change to upgrade one of our warrant clerk positions to a court clerk deputy. It just will allow it. The cost is very minimal, $3,000 a year to have a slightly higher pay grade staff person in our warrants division. This will allow us to have this position does a lot of communicating with other municipalities when an arrest is made on one of our cases, but having a certified law enforcement person in our building is always a benefit. So it's a really big benefit for a very small cost. And it's covered through our cooperative reimbursement program, which means 2/3 is funded by the state already.
Thank you. Comments or questions? Roll call, please.
On item E, Powell,
Yes.
Nelson,
Yes.
you have 6 yeas, 0 nays.
Motion carries. Thank you. All right, last item from the Sheriff's Department is a resolution, the 2021 proposed revision of the distribution process for state administering agency grant funds. So I have a motion by Commissioner Kuhn, who would like to support. Support from Commissioner Hoffman.
I'll defer to the good commissioner here, and I think we got multiple sponsors here, they're bipartisan, but
Yes.
we approached many commissioners, and Commissioner Kuhn was kind enough to take the football and run with it. As you know, and I've talked to you, Madam Chair, about this too, and you've offered your assistance too. Currently, with these grants that come from the feds, there has to be a designated SAA, State Administrative Agency. And in Michigan, it's one of only maybe 4 or 5 states where the Department of State Police or the Highway Patrol in some other states is the recipient of it, but and so they get to decide how the grant dollars are distributed. And we get the short end of the stick. That's what this is all about. We have for many, many years, despite efforts by the sheriff. He's met with 3 prior colonels on this issue, trying to get them to have a fairer way to distribute these funds. It hasn't occurred. And so we're bringing this forward, and you see in the resolution, the suggestion is to have 1 rep from the Michigan Associate Chiefs of Police, 1 from the Michigan Sheriff's Association, and 1 from the state police, which is what they do in a lot of other states. They have panels that decide how to distribute these funds. You know, there's an inherent conflict, and it's in the resolution. I get the money, and then I'm a recipient also, and I can decide how it's distributed. It's inherently unfair to everybody. So we appreciate Commissioner Kuhn and Madam Chair, your efforts, and everybody else on the board. This is a bipartisan thing. The sheriff has already talked to several potential sponsors in the legislature, both on both sides of the aisle, and have gotten nothing but positive reaction out of this. So hopefully this will spur it on, and maybe we can get a fairer way to distribute these funds.
Thank you. Any comments? Commissioner Kuhn?
Yeah, Madam Chair, again, I'd like to thank you for sponsoring this. A couple different commissioners had indicated they'd like to be co-sponsors, so if it's appropriate, I'd like to make a motion to amend to add Commissioner Yolanda Charles, Eileen Kowald, Chuck Moss, Karen Joliet, Bob Hoffman, and myself as co-sponsors to this motion. And there may be others in this.
Gary McGilvery.
Yeah, Gary
Sounds great.
McGilvery as well.
All right, thank you.
Thank you, Madam Chair.
So what we'll be voting on is this resolution with the changes.
Thank you very much.
Sure. Anything else? Roll call, please.
On item G, Powell,
Yes.
Nelson,
Yes.
you have 6 yeas, 0 nays.
Motion carries. Thank you.
Thank you very much.
Thanks for being with us.
Thank you.
Our next item is a grant acceptance fiscal year 2022 access and visitation regarding friend of the court. Who would like to make a motion?
Yes,
Yes.
we renumbered them.
Oh, sorry.
You're next.
Who wants, anybody interested in moving this item?
I'll make a motion, Chairwoman.
Thank you. Commissioner Nelson, support from Commissioner McGilvery. Thank you. All right.
Thank you. Back again. This is the 25th year of this grant. This is federal money that provides for supervised parenting time for clients on our caseload. We bid out the opportunity to apply for this grant again this year. Impact Consulting was the only agency that applied. We've worked with them for a number of years. This year we've been offered $18,000 to provide supervised parenting time for very low residents of Oakland County, very low income residents of Oakland County. They serve, their population generally earns less than $10,000 per year. And this is allows them to see their children despite whether there may be allegations of domestic violence or mental illness or substance abuse, they're still allowed to see their children at Impact with supervision because of this grant. It's likely that additional funding will become available later in the year. That generally happens because we do have such a strong program. So I may be back to seek an amendment later in the fiscal year. A lot of the other counties aren't able to use their funding, and they generally offer us a little bit of extra funding at the end of the fiscal year. So,
Thank you. Any questions? Roll call, please.
On item H, Powell,
Yes.
Nelson,
Yes?
you have 6 yeas, 0 nays.
Thank you.
Thank you.
Thanks for your comments. Our next item is the grant acceptance from the 52nd District Court Fiscal Year 2022 Michigan Mental Health Court Grant Program. With our presenter, Alexandra Black, I have a motion by Commissioner Hoffman, support from Commissioner McGilvery. Thank you. Welcome.
Thank you, and good afternoon. So I'm here for the grant acceptance for the 52nd District Court. For those of you who know me, I'm the court administrator for the 52nd First Division District Court in Novi, but I wrote the grant for the 52nds as a whole, so we cover the 4 corners of the county. Just want to give just a little history for new people in the room. I've been with the county now for almost 27 years, and when I started as a probation officer, we had a one-size-fits-all sort of approach to probationing, if you may. So I would have 500 people on probation, and whether their issue was substance abuse or mental health, we had that one-size-fits-all type of supervision. Over the years, we've had a lot of opportunities. I'm on the Michigan Association Treatment Court Professionals Board, and I've had a lot of opportunity to learn about how we can narrow and have specialties to treat each type of individual that comes through. Most crime that comes through our district courts are substance-related, and a lot of them have underlying mental health issues. Well, since COVID, since lockdown and everything else, we've had a lot of people with some very serious mental health issues that are surfacing, and they're untreated. And as a result, I decided to write a grant to have a mental health court specifically for people who are severely mentally ill and maybe need a guardian ad litem. They really aren't able to function in the community without getting arrested, because the police really don't know what else to do with them. So when those people land on probation and we don't have a specialty court for them, they get the one-size-fits-all treatment, and that's just really not changing the behavior or helping them in any way and stopping the recidivism. So I wrote the grant asking for originally $222,000. I asked for everything. I asked for a full-time probation officer, since we're going to be going around to all the other 52nds. And I asked for lots of funding to support, give us good support services for the people who are coming into the program. We only received
618.
Thank you, 618. Thanks for rubbing it in. That's all we received, but that's the state. All of these grants, just so you guys are aware, the money comes from the revenue that the courts bring in. So when they when revenue went down, as Under Sheriff McCabe mentioned, traffic tickets are down. All of those things are revenue generating for the state, and when those things go down, then grant monies go down, and the state indicated to us that they're treating us as a planning grant, even though in my court, the 52nd District Court, we already have a community advocacy program, which is a modified version of mental health court. So we were ready to start the program, but they consider us planning. So right now, this is what we've received, and as the miscellaneous resolution indicates, we plan on using these monies to still support give support services to the people coming into the program. I'm going to allocate one of my probation officers from the 52nd First Division to utilize her throughout the other district courts, the 52nd District Courts. We'll be accepting from all districts, just so you guys know. I know that some of you represent other courts, 50th District Court or Waterford, 51st. We will accept people in the program from any other jurisdiction that contacts us to ask for a transfer in the county. So I'm asking for the acceptance of this money at this time.
It's a good place to start. Commissioner Hoffman?
Thank you very much. I think the district court system has come a long way in the last 20 or 30 years, and they recognize that substance abuse and some of the other issues people have should not be treated as if they're criminals, and try to keep them out of that system if you can. And I do appreciate your success.
Thank you.
You're welcome.
Anything else? Roll call, please.
On item I, Powell,
Yes.
Nelson,
Yes.
we have 6 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is the grant acceptance fiscal year 2022 Michigan Drug Court Grant Program. I have a motion by Commissioner Hoffman, support from Commissioner McGilvery. Thank you again.
Thank you. And on that last item, I did promise Charlie Cavell I'd give him a shout out. He's on his honeymoon, but he and I had met previously about the mental health court, and he was very excited about this. So I just want to give a shout out that he was very supportive of that. On this grant, well, this has been an existing program. So as I mentioned, I've been here a long time. When we started the treatment courts, it was 2003 when we took in our first participant, and I just found the local news tape on that. That was so funny, taking me all the way back to that. But at that time, when we developed the sobriety court program, we realized after about 10 years that we needed to also not treat the alcohol abuse problem the same as the drug problem. So when opiates became such a predominant problem in the area again, we decided to develop this drug court. We had previously had, just so you guys know, we had a grant for our sobriety court program. The county did end up absorbing those positions, and they were no longer grant funded. The drug court is still grant funded, and we asked for $119,970, and we received $78,500. Again, the state indicated they basically gave the same grant award to every single court across the state, the same as their last year's grant, because they just didn't have the money. The problem with that is our money funds our drug court probation officer. Last year, when we appeared in front of you and it didn't cover the full-time probation officer, we were given a grant match from the county. We were told by Fiscal Services that we would have a grant match. This year, we asked for a grant match from the county, and we were denied. So I just want to make sure everybody knows that we were told we would not get a grant match. So we're forging ahead without the funds to completely fund this full-time probation officer, and we do intend to go back to the state after the first quarter and ask for more, a reallocation of monies from the state for grant funds, which is what we ended up doing last year and didn't use our grant match money from the county. So this year, we're going to have to do the same thing and keep our fingers crossed because we don't want this program to end. It does save lives. We have all of the evidence to show that we've helped save a lot of lives of people, family members, and in that program, just like our sobriety court program, we do take from other courts as well, so we do support the entire county with that. So I want to request a $78,500 grant acceptance.
Thank you. Commissioner Powell?
Chair, I wanted to ask if we could look into that matter to see why we were willing to match it last year and now we're not. I just really would like, especially, I think you said y'all didn't even use the funding?
We did not. We went
Okay,
back and asked
so-
the state, and we didn't use it, one penny of it.
Okay, so, Chair, if possible, I don't know if you want me or if you can just call a question, but I think I am a yes vote for the grant, but I would like to look into that, especially if they didn't use the money last year. And if we do run into a problem, can we at least safe haven it or get clarity as to why we denied them?
Okay,
Thank you.
we will direct staff to do that.
Okay, thank you.
I appreciate that.
Yeah.
Thank you.
All right, and anything else? Roll call, please.
Powell,
Yes.
you have 5 yeas, 0 nays.
Thank you.
Thank you. Thank you so much.
Oh, no, we don't have one more for you. Thank you.
No, I'll stay there.
The next one is the grant acceptance fiscal year 2022 Michigan Drug Court Program from Rochester Hills. Who would like to make a motion by Commissioner Hoffman, support from Commissioner Kuhn? And we have Amy Luce here to speak to it. Oh, do we? Yes, we do. Thank you.
Good
And
afternoon,
Shelley
Commissioners.
McLeod. I'm sorry.
Yes,
And I see Shelley McLeod there also. Thank you.
Thank you, Commissioners. Shelley is our program coordinator for our drug court program, as well as the probation department supervisor. Thank you for giving us this opportunity to appear before you this afternoon and request approval to accept our grant award from the state to continue our specialty treatment court program, which is our drug and alcohol program. Like Novi, we received the exact same award we received last year. We are also going to be in a position where we are going to need to request additional monies from the state after the first quarter to cover the expense of our one full-time probation officer that is in this program. We were also denied a grant match that we were given last year. We did not use all of our grant match funds from last year. And we've, trimmed everything we possibly can to make the program still effective. That being said, I'm sure you remember the details from other years' presentations. It's an 18 to 24 month program consisting of 3 phases. We currently have 21 participants. Over the past year, we've graduated 8 participants and admitted an additional 12, which we are very proud of given the circumstances. Tickets aren't being written as much. It's just been a very different year, as you are all well aware. The other thing I want to point out, too, is that every single criminal case that gets filed with our court does get screened by our staff to determine if the defendants would be eligible for our specialty treatment court program. Those criteria are completely objective. It's the same criteria for every file, for every charge, and it is, they either meet the criteria or they don't. The other thing I want to point out is that this program is completely voluntary. The defendant has to agree to participate in the program. Our judges just don't order them into this program without their consent and without the defendant volunteering to participate. And I think that that's, again, important with our statistics given this year, and that there have been those people that we have been able to reach out to and really change their lives. We are proud to say this year as well, we have a former graduate of our program that has come back to mentor other participants in the program. He participates in our team meetings and provides just absolutely invaluable resources and information, and offers a perspective that we haven't had in the past. So that's a really, really big accomplishment and a really big step forward for us. So we really would like to be able to continue this program and not have to make those very, very decisions later on in the year.
All right, thank you. So that would be 2 grant matches that were denied. We will direct those questions to staff. Thank you. Commissioner Powell?
Oh, no, I was just gonna make sure we got her name, and I have her follow up with me as well, so thank you for catching that.
Sure.
Yeah, thank you.
All right, any other questions? Roll call, please.
On item K, Powell,
Yes.
5 yeas, 0 nays.
All right, motion carries. Thank you both.
Thank you.
All right, our next item is a grant acceptance fiscal year 2022 Michigan Drug Court Juvenile Drug Court Program. I have a motion by Commissioner Powell, support from Commissioner McGilvery. And who do we have? Pamela Monville. Oh, and Nate Grilling. Oh, and John Kupenreiter. All right, welcome.
The gang's all here. Thank you,
Yes.
Commissioners, for having us today. This is our annual request for the committee to accept our grant funding received from the State Court Administrative Office for our juvenile drug court program. The amount this year is $40,000. It's for fiscal year 2022, which runs October 1st. 2021 through September 30th of 2022. You see I have John Kupenreiter, our budget guru, and Nate Gilling, our supervisor of the program, to answer any specific questions. But generally it runs as it has in the past.
Thank you. Are there any questions? Well, your show of people worked. We're going to call the roll now.
On item L, Powell,
Yes. Just,
we have 5 yeas, 0 nays.
Motion carries. Thank you. Commissioner Powell.
I just wanted to explain, I keep hearing our guests reference the alphabet. Just so you all know, we had to move an item over, so that's why y'all keep hearing the letter 1 off to our guests, just so y'all know, okay? Yeah.
Thank you. All right, thanks, everybody. Oh, you're still on for the next one. The grant acceptance fiscal year 2022 Michigan Drug Court Adult Treatment Court. So I have a motion by Commissioner McGilvery, support from Commissioner Powell. Thank you. All right, we're ready again.
All right. Yes, this again is our annual request for you to accept the drug court, our ATC grant received from the State Administrative Office. The grant amount is the grant is for $279,000. It's for fiscal year 2022, again, running October 1st, 2021 through September 30th of 2022. Again, this runs runs the same as our other, our previous treatment court. Nothing has changed as far as this, and we have John and Nate to get into any specifics if he'd like to hear.
Thank you. Comments or questions? Roll call, please.
On item M, Powell,
Yes.
we have 5 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our next item is a contract with the Adult Treatment Court Interlocal Agreement with Oakland County Health Network. I have a motion from Commissioner Powell, support from Commissioner Hoffman. We're ready again.
All right, great, thank you. This is a request to approve the attached interlocal agreement with Oakland Community Health Network. Oakland Community Health Network provides a person as a team member to our ATC our program to help with the mental health portion of the program. We received the same amount of funding as last year, but with the compensation study, some of these the salaries for the position covered by Oakland Community Health Network has risen. So we need to do some adjustments on the line item. And if you need more detail, John can speak to those. But the interlocal agreement needed to be revised for an adjustment to the pay. And also the State Court Administrative Office had asked us to put in an indemnification agreement for third-party contractors. And so we needed to tweak that language. That language was provided by Corporation Counsel, and the third-party contractors to our adult treatment court program, and they're all on board. So this is just to revise this interlocal agreement and cross our T's and dot our I's.
Thank you. I do have a question. Is the person that this grant covers the same person each year? Do you have continuity there?
Yes.
Thank you. Any other questions? Roll call, please.
On item N, Powell,
Yes.
we have 5 yeas, 0 nays.
All right, thank you. Thanks
Thank
for
you,
your
Commissioners.
time.
Thank you.
Thank you. Have a great day.
Thank you. Our next item is a grant amendment, fiscal year 2022 Emerging Threats Local Health Department Agreement Amendment Number 1. I have a motion by Commissioner, who would like to make a motion? Hoffman, support from Commissioner McGilvery. And let's see who we have. Oh, again, a number of people. Stacy.
Good afternoon. This is Stacy Smith from the Health Division, sitting in for Leanne Stafford. I have with me Dr. Faust and Kate Guzman. This is Amendment Number 1 to the fiscal year 2022 Emerging Threats Local Health Department Agreement in the amount of $1,113,527 for the period October 1st through September 30th, 2022. This funding is through the Michigan Department of Health and Human Services. The amendment provides funding to support monitoring of COVID-19 virus shed into the public sewer system and increases the total award amount to $10,615,940. Also being requested is to transfer one part-time, non-eligible special revenue medical technologist position within the laboratory unit from the local health department grant to the fiscal year 2022 Emerging Threats Agreement. I have Kate and Dr. Faust if you have any questions about the COVID sewer grant.
Thank you. Are there any questions? Commissioner Kuhn.
Yeah, thank you, Madam Chair. Can you just give us an update on this, on how the studies are going? I know you gave us an update in July or a couple months ago.
I'd be happy. Thank you. So this study, as you know, is a team, a multidisciplinary team composed from the Water Resources Commission, epidemiology, public health laboratory, public health nursing, environmental health, and also academia, MSU specifically. And we have proposed to evaluate wastewater from congregate living facilities. Previously in our pilot, we had assessed wastewater viral load in 3 water treatment plants, but it's very difficult to actually have actionable data when we're looking at large multi-zip code collections or sewer sheds. So we've been focusing down on congregate living facilities. It has been going extremely well. And in fact, I'll boast about our lab. The state has told them that their data is the cleanest of all the labs in the state right now, and they don't have to, quote, clean the data when we submit it. So that's been going well. We have, thanks to Kimberly Snowden, we have been sending out teams of nurses to test through those residents and been able to isolate those that have been positive. And again, it's been going well enough that we are in fact looking to expand to some other congregate living facilities, and specifically a senior living facility right now.
Okay, thank you, Dr. Faust. Thank you, Madam Chair.
Thank you.
I just want to take this opportunity to mention, because I'm pretty geeked about this program. The CDC is pushing this to build this national network of these collaborative teams, because they're convinced this will not be our last pandemic, and that's probably pretty accurate. And for COVID specifically, and we've been seeing this with our data, specifically, people shed COVID in their feces, and we detect an uptick in viral load in wastewater at least a week, approximately 8 days prior to being able to detect those cases, that is shedding virus in the upper respiratory secretions. This is a huge benefit, and this is why CDC has been really pushing this program. And I think moving forward, whether we see that phenomenon in other viruses, the value will be these collaborative teams that they're establishing nationally as a network. Thank you.
Thank you. And it is amazing, isn't it? Who would have thought that? All right. Any other comments or questions? Roll call, please.
On item O, Powell?
Yes.
You have 5 yeas, 0 nays.
A motion carries. Thank you. All right.
Thank you. And can I just say,
Sure.
Madam Chair, thank you, and thanks to the commissioners for the work you're doing and continuing through these unprecedented and very challenging times. So thank you all.
Thank you.
Thank you.
Our next item is also from the Health Department, the 2022 Local Health Department Agreement Amendment 1. So I have a motion from Commissioner Powell, support from Commissioner Hoffman. All right, glad you stayed.
Stacey Smith again from the Health Department, and I have with me Kate Guzman, and I believe on the phone is Calandra Green. This is amendment number 1 to the fiscal year 2022 local health department agreement in the amount of $455,503 for the period October 1, 2021 through September 30th, 2022. This funding is also through the Michigan Department of Health and Human Services. The amendment provides funding for the HIV PrEP Clinic, Children's Special Health Care Services Vaccine Initiative, and the Harm Reduction Support Services. The total award amount at this point is now $11,885,913. It is also requested to delete 1 vacant part-time non-eligible special revenue medical technologist position within the laboratory unit. I have Kate and Calandra if you have any questions regarding these programs.
Thank you. Are there any questions? So the deletion of the part-time med tech due to lack of funding, how would that affect the department?
Hi, this is Kate Guzman. That position was just moved over to the sewer grant, so that was the addition of it was just a swap of funding.
Thank you.
No, thank you.
Okay, any other questions? Roll call, please.
On item P, Powell?
Yes.
You have 5 yeas, 0 nays.
Motion carries. Thank you. One more item from the Health Department is our fiscal year 2022 interlocal agreement between Oakland County and Oakland Community Health Network for Substance Use Disorder Prevention Services. Have a motion from Commissioner McGilvery, support from Commissioner Hoffman. Thank you. Thank you.
I like my name.
As the meeting moves into the 5th hour of the motions and supports, it's slower and slower.
I like my name in the minutes.
Oh, thank you. Okay, perfect. Welcome.
Stacy Smith again from the Health Division, and joining me with Lisa McKay, who looks like she doesn't have any sound. This is the fiscal year 2022 local agreement between Oakland County and the Oakland County Health Network for Substance Use Disorder Prevention Services for the period October 1, 2021 through September 30th, 2022. The total program award amount for fiscal 2022 is $220,491, which consists of $199,992 in grant funding and a local in-kind match of $20,499, which is budgeted in the health department's general fund. This fiscal year 2022 grant is has an increase from last year's grant and award of $218,833, and during that time the match was $19,894. This grant continues to full-time eligible special revenue public health educator 2 positions.
Thank you. Any questions? This is not something new. This is ongoing for us. All right, roll call, please.
On item Q, Powell,
Yes.
we have 5 yeas, 0 nays.
All right, thank you. Thanks for staying with us.
Thank you.
Our next item is another grant acceptance, 2021 Annual Action Plan and 2021 through 25 Consolidated Plan Acceptance for Community Development Block Grant, Home Investment Partnership Act Program, and Emergency Solution Grant Programs. With support from Commissioner McGilvery, motion by Commissioner McGilvery, support from Commissioner Hoffman. And we have Shane Bias here from our housing area to speak to it. Thank you. Welcome.
Thank you, Madam Commissioner, and I do apologize for those long titles. This is our annual acceptance of our 3 main grants from HUD for our program year 2021 that begins July 1st and ends June 30th. As a reminder, we're able to roll over our funds, so even though it's already kind of 3 months into our program year, we accept it, the funding now, and then we can spend it after June 30th up to a certain amount of time. This is the acceptance of the Consolidated Plan and the Annual Action Plan that this committee and the Board of Commissioners already approved about 2 or 3 months ago. That was the big 500-page document. And again, this is just our regular funding to support our continued services, including our housing counseling services, our home improvement program, the community development block grant funds that goes out to most of the communities in Oakland County, as well as the new program we're going to be standing up for rental development and preservation of affordable housing rental units, gap financing that we're going to start here shortly. The funding is a little higher compared to the last couple of years, but it's consistent with what we normally get. And this goes to support all of our positions in our division. So with that, and being respectful of everybody's time, I'll pause there for any questions if anybody has any of those.
Thank you. Commissioner Hoffman?
Thank you very much. I have a question regarding the Home Improvement Program Revolving Loan Fund. So if somebody wants an improvement made to their home or roof, furnace, whatever, we put up the money, either Oakland County or through one of the municipalities, the money is passed on to. And after a certain period of time, the money is paid back. Is that correct?
That's correct. So the home improvement program is set up to offer 0% deferred loans to those eligible homeowners. And at the transfer of ownership of the home, either when they move or perhaps when the main owner passes away and they transfer that ownership, that loan will come due. And then we take that money and then we reinvest that money into supporting additional home improvement projects. And in the future, a portion of that will also be to support the rental gap development financing program.
Okay, I appreciate that, and I support that because, you get to recycle that money and get to use it again, whether it's 5 years, 20 years. Yeah, okay, thank you.
Thank you. Any other questions? Roll call, please.
On item R, Powell,
Yes.
we have 5 yeas, 0 nays.
Motion carries. Thank you. Thanks for waiting with us. Our next item is a grant acceptance for fiscal year 2022, the Community Corrections Comprehensive Plan. I have a motion by Commissioner McGilvery, support from Commissioner Hoffman. Thank you. And Eric Schmidt is here to address this item. Thank you. Welcome.
Yes, and so this is our annual request for you to accept the Community Corrections Comprehensive Plan under the Michigan Department of Corrections Community Corrections Public Act 511 grant that we've received since 1994. We had put in an application in March. The deadline was in May of 2021, where we had requested $1,922,553. And we were happy to learn that we were awarded $2,022,553 for the fiscal year, obviously starting October 1 of 2021, going through September 30th of 2022. So that is an increase of $100,000. This grant will continue the funding for 13 positions and partial funding of 2 positions within community corrections that provide our program services, monitoring, and operational oversight. The Sheriff's Department also would continue to have the funding for 3 full-time eligible inmate caseworker positions within the Community Services Division, provides jail services under PA 511. And so with this $100,000, the grant will allow to convert 1 part-time community corrections specialist 2 position into a full-time eligible community corrections specialist 1 position within our pretrial services supervision unit. And so with that, I'll stand by for questions.
Thank you. Are there any questions? We did a great job explaining. No questions. We'll go to roll call.
On item S, Powell,
Yes.
we have 5 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you. Have a great day.
Thank you. Our last scheduled item on the agenda is a grant amendment for the Emergency Management Program. Amendment number 1 from Emergency Management and Homeland Security. I have a motion by Commissioner McGilvery, support from Commissioner Hoffman and Mr. Seeley.
Hello, Rob Seeley, Chief of Emergency Management. How are you guys doing? I was just here a couple weeks ago, actually, to get the original grant acceptance for this grant. And as soon as I got back to my office that day, the state actually sent an amendment to that based on ARPA funds, American Rescue Plan funds that they received. They redistributed them in an additional 31% of one salary, which would have been for last year, which was Tom Hardisty's salary. In the future, it'll be mine, but additional 31% of that salary, and that has already come into the county. So we're just here for the grant acceptance.
Thank you. Any comments or questions? Roll call, please.
On item T, Powell,
Yes.
We have 5 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
All right, our next item in this meeting is public comment. Is there anyone from the public wishing to comment? If so, please come to the end of the table. State your name and address, city you're from. Welcome.
Thank you, Commissioners. This is Catherine Kennedy from Lake Orion. And actually, one of the things I'd like to look into, excuse me, my phone is ringing an alarm for my granddaughter. I forgot about it.
Yeah. Can hardly hear it.
Oh, I'm sorry. So, sorry for the interruption. Yeah, I am very happy to see that we at least have some sheriff support on the board with some of the resolutions increasing funding for these things. I'm very confused, however, on the community block grant program and the home which the HUD funds relate to. I've had some other meetings where those things were discussed as being available to all refugees and immigrants. And a lot of the verbiage that I've seen in the documents in this board seem to have substituted the word citizen for resident pretty regularly. I do appreciate the mental health things that we're doing in this county. I do think it needs to be everybody. I don't think you can go by free lunches to determine who has a mental health issue. And so I agree with Mr. Hoffman's comments that it really needs to look at the entire county. And I would like to have a lot more participation of the citizens to have a better understanding of how these grants are administered. These grant programs seem to always be administered by outside agencies, with them simply giving the board a report quarterly that they create for the money that they've spent. That, to me, is not enough accountability of an organization or public funds. I really believe that I have an issue with the mental health things because out of the 62 applications for mental health, 100% of those bid applications were reviewed by United Way. Did the commissioners even get a copy of the bid applications for the 62 people that applied for the mental health grants? I haven't found it. I don't know if any of you saw it, or if the entire amount is simply given to United Way to take on the responsibility of reviewing all the bids for all the programs, for all the grants pertaining to mental health. That, to me, kind of puts you in a position, you might put yourself in a legal situation. I don't understand why, if the commissioners do have the data to review, that's one thing. If they don't have the data and you're relying entirely on a third party who is taking our grant money and deciding who gets to spend what, with only a quarterly report to the board, I'm very concerned about every grant in this county. I genuinely am. Thank you very much.
Thank you, Ms. Kennedy. Anyone else for public comment?
Sandra Carland from Novi. I would just like to echo what Ms. Kennedy said as far as transparency in the funding that's being spent. As far as I understood, these grants were given, federal money were given, or state money, whichever it is, to our community. And while we are supposed to be represented here by our districts, my district representative has never represented my viewpoint. And so I think that there needs to be more transparency about the places where these money, the buckets that Mr. Woodward called it, that they put this money into. I'd like those buckets to be transparent, not opaque with a cover on them. So that I would like to know where the money, the $244 million is going, and what organizations, and what the criteria was to say this one gets it and this one doesn't get it. And so I think that you owe that to the community, the county, to let us know. And at one of the earlier meetings today, I asked all of the people there, they were passing some 400-page bill, and I said, could you please show by a show of hands who has read this bill? Not one of the commissioners had read the 400-page bill. I bet you Catherine would have read it if you'd given it to her. But I just find it very alarming that, you know, we're paying your salaries to do this job. We want you to do this job. We don't want United Way to do this job. They are not an Oakland County business. They are not an Oakland County governmental agency. And their viewpoints might not be in line with what the Oakland County people's viewpoints are. So I would like to see much, much more transparency regarding where these grants are coming from and where they're awarded. Thank you very much.
Thank you. Anyone else for public comment? All right, public comment is closed. There is no other business to come before this meeting, so I will adjourn the meeting at 1:21 p.m. Thank you, everybody.